Hey, what's up, everyone? Nurse Jar here. Welcome to my YouTube channel for nurse aid training. In this training video, I'll be demonstrating the 2023 Prometric Testable Skill Performs Range of Motion Exercise for one hip, knee, and ankle. Now, for training purposes, I'm performing this skill or doing this demonstration on a mannequin. But for testing, this skill is performed on a live person. Before I get started with the demonstration, there's just a couple of pointers that I want to share with you. One, you have to go the full range of motion for that joint. Two, you have to support the joints underneath the ankle joint and underneath the knee joint, okay? You have to perform the exercises nice and slow. Also, you will want to instruct the person before you start the exercise, during, and after if they're feeling any pain or discomfort to let you know. Let's go ahead and get started. Hi, good morning, Mrs. Jones. How are you? Awesome. My name is Julie. I'm your CNA, and today I'll be performing some exercises on your right hip, knee, and ankle, okay? All right, before I get started, I just want to make sure your bed is in a low, safe position, and it is. Your bed wheels are locked. I'm going to hand you your call light in your right hand, and I'm going to provide you with some privacy by closing your privacy curtain. Mrs. Jones, before I go wash my hands, is there anything else I can do for you? All right, Mrs. Jones, I'll be right back. Washing hands. All right, Mrs. Jones, I'm back. What I'm going to do is just raise the level of the bed to a comfortable working height for myself, okay? So you're going to be feeling the bed rising upwards. Okay? And then I'm just going to uncover your right leg, okay? All right, there we go. All right, Mrs. Jones, before I get started with the exercise, if you start feeling any pain or discomfort, let me know and I'll stop the exercise and go get the nurse. Okay, Mrs. Jones, so I'm going to be performing two different exercises. The first exercise is going to be for your knee and hip joints. I'm just going to flex your leg upward and then extend it back down onto the bed, okay? All right, Mrs. Jones. The second exercise that I'm going to do is for your ankle joint. I'm going to bend your foot downwards toward the bed and then flex it back upwards towards your head, okay? All right, we'll be doing both exercises 3 times. Okay, Mrs. Jones, again, if at any time you're feeling any pain or discomfort, let me know. Okay, are you ready to get started? All right, Mrs. Jones. So I'm going to support underneath your ankle joint and underneath your knee joint, okay? Again, if you feel any pain or discomfort, let me know. All right, I'm going to bend your knee towards your head, getting the full range of motion, and slowly bring it back down. You feel okay? Awesome. Let's try again. Here we go. And back down. You feel okay? All right, last time, Mrs. Jones. And back down. You feel okay? Awesome. All right, Mrs. Jones, let's get started on the exercises for your ankle, okay? Okay, Mrs. Jones, if at any time you're feeling any pain or discomfort, please let me know so I can stop and I'll go get the nurse, okay? All right, so I'm just supporting your leg by placing my hand underneath your ankle joint. I'm just slightly raising your leg off the bed, and then I'm going to bend your foot downwards, nice and gentle, and then flex it back up towards your head. You feel okay? Awesome. Let's try this again. Flexing it downward and upward. Okay? All right. Last time, Mrs. Jones. There we go. Awesome. Any pain? All right, Mrs. Jones. I'm just going to place your leg back down on the bed and get you all covered up. All right, you doing okay? All right, Mrs. Jones, how do you feel? Awesome. All right, I'm just going to lower your bed back down to a nice, low, safe position. Your bed wheels are still locked. You still have your call light in your hand. Would you like for me to open your privacy curtain or keep them closed? Open them? Okay. Go ahead and open these back up for you. All right, Mrs. Jones, I'm all done. Before I leave, is there anything I can get you, like a magazine or some juice or some crackers? No? Okay, you're comfortable? All right, Mrs. Jones. Well, you have a good day, okay? All right. Washing hands, skill complete.